Good morning. Welcome back to Cannabis with Kim. I just found this old menu from what it used to be called the clinic. Look at that. Before rec, people. Cash. Things were a little bit cheaper. All the different concentrates for a gram. You know, they were just going under 60. And then, of course, we had our vapes, and you can see $55 cartridges, edibles. Look at how cheap those were. Yeah, $20 Incredibles. I don't think they've been under 30 since rec started. So anyway, I just thought it was kind of fun. I was just starting my morning with a little dosed coffee and cinnamon, and also just did a quick high supply. I had my last implant done yesterday in my mouth, and I am feeling pretty good today. So yeah, I just figured I would dose. I've been trying to stay dosed and on the meds just to prevent any pain. Anyway, today, since again, remember my knee surgery appointment was earlier in the week, and then I had my mouth surgery implant put in, and so I'm pretty much hopefully done with surgeries. So I figured it would be kind of a good day to talk about a few extra definitions and concepts. Now, I know we've already talked about cannabinoid. We did I talk about cannabinoids all the time, but those are the, let me throw this in here. When we hear the word cannabinoids, we think these: CBD, CBDA, CBG, CBGA, CBC, CBCA, and then of course our THs. So we've got our THCA, regular THC, and then THCV, and THCA. Oh, I already said that. It's on there. Okay, so it says, what are cannabinoids? So we already talked about this. There's over 480 natural compounds found within cannabis plant. Now remember, this data too is about, 2020 shut down, so I didn't go to any new workshops in 2020, but this is from 2019. So hoping more information has been, gathered since then. And then of course, our CBD. I just wanted to, since we're looking at this, give you a second so you can see all of our benefits. Okay, so just strictly CBD, and then remember we've got our different cannabinoids that veer off, right? Our CBDA, I've been talking about CBG, and then CBC, CBCA, and all those. So now our basic rundown of CBD is, and this even surprised me when I first learned this, an antibacterial. So it inhibits cancer cell growth, neuroprotective, promotes bone growth, reduces seizures and convulsions, reduces blood sugar levels, reduces function in the immune system. Reduces function in the immune system. I don't know if that's worded properly. Reduces inflammation, so it's an anti-inflammatory for the body, just like ibuprofen. Reduces risk of artery blockage. So they're finding a lot. I don't think they have it on here, but it's also reducing the risk of Alzheimer's by cleaning the plaque from the brain. That's the newest science that they're finding as well. Smaller intestine contractions. So if you struggle with IBS, here I'll use this as my pointer. So if you struggle with IBS, you know what intestine contractions are. It feels like your gallbladder is going to burst. That's the level of pain. I found that out once because I thought I was having an IBS attack, but my appendix was exploding. So beware, people that suffer with IBS. We are people that can handle massive pain. Relieves pain, relieves anxiety, slows bacterial growth, because obviously it's an antibacterial. Suppress muscle spasms, tranquilizing, treats psoriasis, and I apologize, vasolecitins? I don't know if I pronounced that correctly, and I apologize. Feel free to, can you send me videos? Tell me how bad my pronunciation was. So let me swing this around so you don't have to look sideways. So CBDA, so then they kind of break down the specific compounds, and again, the CBDA inhibits cancer cell growth, which is just so amazing. And I'm hoping to have a testimonial from somebody that I've known. He battled a type of brain cancer, and he did it all with concentrates. A lot of RSO oils really helped him. I think RSO is under ingestible oils. So down at the bottom, ingestible oils. These are very high concentrated. A lot of times they call them RSO oils. Yeah, this is what he fought his cancer, and he did nothing else. So I'd like to get an interview with him. He's just super busy. He's also a grower, so I'm hoping to get a lot of information from him as well. So CBG, now this is a great one for us, aids sleep, and also, as you can see, it inhibits cancer cell growth, promotes bone growth, slows bacterial growth. CBGA reduces inflammation, relieves pain, slows bacterial growth. CBC inhibits cancer cell growth, promotes bone growth, reduces inflammation, and relieves pain. CBCA reduces inflammation and treats fungal infection. I'm doing some research right now. In fact, today it's on my things to do list. I am looking for my things to do list while I'm allowing you guys to keep reading this. I might have already brought it downstairs to start my check marks. But yeah, I'm going to be looking up, because Lyme disease as well. I don't know if I posted this yet, but the CBs, they say if you are suffering with Lyme, to stick with your very high CBs and low THCs. So I'm sorry for anybody that was looking for help with that. Oh my gosh. Well, I will do another post when I find my notes and when I get the answers for the other symptoms and disease that one of my friends contacted me regarding. So I'll bring that up in another video. But let's quickly take a look at our THCs, because what's happened over the past 10, 15, 20 years, the growers have been really obviously breeding out the CBs, because what do CBs do? They cure a lot of stuff and help with a lot of stuff, but they don't get you high. And so that's what THC does, right? So if you don't want psychotropic, which many people do not, you stick with the CBs. And of course, you can see they help almost everything. Now, what are THCs or THCA or THCV, or what are these good for? Well, plenty of things, okay? Not just getting you high. It's not just the psychotropic effects that you get. And it also takes a little bit of THC to actually kick your CBs in. So even if you look at hemp, there's always a slight amount of THC, very small, but they work together, okay? Because again, it's a synergy. And remember the entourage effect definition that I showed you before. We layer. Okay, so THC, you can see, aids sleep, also inhibits cancer cell growth, and it also suppresses muscle spasm. And some people also don't react well with CBs. You need to remember, I always tell you guys, be your own advocate. I want to put this out there because when I was working with a patient that I met several years ago, she found out after going heavy with the CBs that her body was rejecting it. It was like allergic to it. It was just having a terrible reaction. So she had to switch over to strictly THCA. So I just want to point that out, just in case anybody out there has experienced or heard of anybody experiencing anything weird with the CBs. Now, don't be thinking you're having a problem with CB cannabinoids if you bought your CBD oil through like a gas station or one of the clubs or online, unless you know it's 100% reputable, or you made it yourself from hemp, or from flower, from cannabis. Do not consider your body not reacting well to this until you've tried medical grade and it's right. Okay, I just want to put that warning out there, because the crap that you're spending 40, 50, 60 bucks on in the liquor stores, gas stations, parties, clubs, online, no, that's all crap. You don't do that. Make your own. So anyway, here we go with the THCs to continue on. Now, this is why when I also suffered so terribly with IBS, I mean, I couldn't do a road trip without, planning out every place that there could possibly be a washroom. It was horrible. I just think about my 30s. I mean, why couldn't this have been legal then? I would have had way better decades. Let me tell you that. Because I'm going to tell you, the reducing, vomiting, nausea, of course, this is when we start talking about cancers and chemo, right? And you're doing all that, putting all those poisons in your body, or even if you have just a lot of nausea. And this also as well, I know there's a lot of controversy with pregnant women, but compared to the pills, the pharmaceuticals they want to put them on, I say, this is wonderful. If it was a choice between a pharmaceutical, because a lot of pregnant women, have terrible nausea and they can't get the proper nutrition in their body to make their babies healthy. They don't feel well. I mean, 9 months of misery is no way to live for you or your baby. That stresses your baby. So, this is one of the things that, I know a lot of controversy, but so many more studies will, start as soon as it goes federal. So I'm just telling you, this again and it stimulates appetite, and most of us are thinking, I don't like having the munchies. No worries, it's okay, because you don't have to have the THCs that stimulate appetite. In fact, certain strains do not specifically stimulate appetite, but many do purposefully, because there's a lot of diseases and sickness out there that a lot of people can't eat. So this is crucial, especially like I said, in terminal patients as well. This is where you want to be, instead of like morphine and massive opiates. So anyway, moving on to THC, obviously it just relieves pain. And then THCV, and what they don't have here in the notes that I've already taught you about, is THC doesn't only reduce convulsions and seizures, promotes bone growth. THCV is also for energy, because THCV is usually found in your daytime strains. Durban, to be specific. Let me zoom. Durban. THCV is a cannabinoid that's released at 418 degrees. So this is a tricky one to get to. I do a ball jar method that I have a video on for this one. So this one is energy, and this is appetite suppressant, not stimulant, suppressant. So this is how I lost 70 pounds after my spinal operation, after I had turned these into oils and I discovered THCV, and I was losing weight. And so Durban has been hard for me to find, so I'm trying to get back to that, because the THCV, once the big farm gets a hold of that information, they're going to start duplicating it, I promise you. So anyway, there's our cannabinoid wheel again, and in a little more detail. I hope this was informational for you. I know I did the cannabinoid chart, and I think I did Cannabis Man, and I showed you all the different cannabinoids here, the different forms of taking it, what it does for you. So I have that whole video too on Cannabis Man. But this wheel I really liked. I thought it broke it down very nice and kind of included some things that we haven't seen on the other ones. So when I was pulling out my definitions, obviously I started with cannabinoid again and went to the wheel. And so I just really wanted to mention today, because I haven't really talked about it, is a caregiver. In Illinois, you can get your caregiver card, which means if you have a family member or, somebody that is ill and or doesn't want to go to the dispensary, just like will not accept that this is a holistic way of, living, or is afraid, whatever. There's been 70 years of propaganda, so it's a scary thing to even talk about for a lot of people. So you can be a caregiver and you can get your own license and you can purchase. Now, legally, a caregiver does not intake. So, legally, you're allowed to drive with it, sealed. Legally, you're allowed to deliver it to the person you're taking care of. Okay, so keep those things in mind. So a caregiver's role is legally to pick up and deliver it. Okay, and I'm hoping pretty soon in Illinois, because I know it's already in Colorado and I believe California for sure, but there's delivery and not even delivery, to your family. It's delivery to anybody. Like you can order and they'll deliver your strain or whatever from the dispensary for you. So I'm sure there's going to be some type of, but even caregiver, now that it's rec, you probably don't even need a caregiver license. But who knows? We might see that. I'll keep my eyes open and keep you guys posted on that when Illinois starts moving over into that. But also, I really want to start discussing grow, because yes, I am going to attempt to grow small amounts this summer, and I'm hoping to get my clones. So a clone, you take a clipping from one of the plants, okay? So it's going to be the identical plant, okay? So cell product or organism that's genetically identical to the unit or individual from which it is derived. Now, clones, of course, is going to be a direct lineage. Obviously, you just cut it off of the plant you want. So the great thing about clones is you know what you're getting. If you know the flower before that you got, then now, of course, you're going to know the same one. And then more stuff about growing, cross. Okay, so when we're crossbreeding, that's how a lot of hybrids come along. I mean, that's where all of these crazy names come from, right? So, well, you've got, I remember, Ultimate Platinum Girl Scout cookies, every kind of kush on the planet, right? Strawberry kush, strawberry cough. So these are all our cross, breeding. And that's a lot of what the dispensaries are doing right now to, crank up our percentages on the THC. How do you think we're getting it up into the 30 percentile, right? So, and then now this is something, because so don't laugh at me if you're a grower. I'm just learning about growing. So, I always thought, oh, you grow your pretty buds. Oh, they're so pretty. Great. So you clip and you trim and then you smoke, right? No, that is incorrect. You cure. And so this is the control. So whenever you've seen them hanging upside down in somebody's garage, like clips from TVs or people you might know, that's the curing process. So you actually need it to really improve the quality of your cannabis. Okay, so I didn't really know that. So that was kind of cool for me to learn or hear. And then of course, when I actually start to grow, this is when I'm going to be putting these things into the works. And then of course dabbing. I wanted to just throw that in there since We've already talked about entourage. Look at this. We're getting through our definitions so well. So dabbing, this is, as I started the video, with concentrates. And all these pictures of concentrates are different kinds. Crumbles, waxes, live sugar, live butter. What are some of the other things? Pull and snap. Yep, wax, crumble, sugar. Oh, don't forget the sauce and live rosin, okay? And what do you do when you get it in this concentrated form? It's not activated yet, okay? These concentrates are just like flour. They need to be activated by heat. So this is one of the things we call is dabbing, okay? So dabbing, a slang word used to refer to a dose of BHO received through butane combustion and inhalation. The act of dabbing refers to partaking in dabs. So anyway, you usually get yourself, I'm sure you guys have seen the rigs and people love it. I just feel like dabbing is a little too over the top. I guess if I'm in massive pain or I really just want to get stoned, wasted, I'll dab. I mean, it's heavy. I mean, your normal, I always cook with those two and they're up in the 80, 70, 80, 90 percentile sometimes, and you're hitting something at a 70, 80, 90%. It's like a vape, but heavier, harder core. All right. So just wanted to point that out. So warning label should be slapped on dabbing. Should be done. And not all of them are pulled from butane. Okay, because obviously I just showed you a huge selection of them, and there's all different ways of pulling all of the goods out. Okay, so that's why there's all different kinds. They're actually, produced differently depending on which one you're doing. So that is that. The only other thing I wanted to do, because since we ended with edibles, because edibles, I got videos, baked goods, hard candies, drinks. So more stuff to come. But I know I've talked about dosing, but I thought maybe you'd like to see it so that you can actually see. I'm a better visual person when I hear somebody talking. So that's why you always are seeing paper or pictures in front of you. So when we talk about the micro dosing, okay, and you can see micro dosers, first time consumers, all right, you want low, like barbecue. Remember? Edibles, like barbecue, low and slow until you got yourself, moving. And then, you work your way up. So, for us big timers, we're down here, we're at like 30 to 100 milligrams. I'm not feeling a 10 milligram gummy. I'm not feeling a 20 milligram gummy. So for people that have chronic pain and are using on a regular basis, intaking, now that doesn't just mean smoking. I know a lot of smokers think that they're tolerance is way up. Well, your tolerance is way up for what you're smoking because you're killing so many of the cannabinoids. So honestly, even if you are a big time smoker, I've seen big potheads, get blown out of their, chair at a 30 milligram dosage and don't feel good about it. So, don't be a cowboy. Don't go flying into the heavy doses because you think you've got a high tolerance. So just, work your way up. And especially if you are a smoker, then your edibles should start kicking in within, it's like acid. It's like within about 45 minutes, And then if you take your edible and you smoke on top of it, it'll come in quicker, because it'll get your cannabinoids flowing in your body. So just wanted to throw this informational sheet out for edible dosing. I might do a whole nother, video on dosing to give you more details or answer any questions. This one's from Leafly, obviously. We've got our, but here is that good advice at the bottom. Always begin at the lowest recommended dose, gradually increase by 1 to 2 milligrams per dose if necessary to find your optimal dose. Okay, so really, again, be your own advocate, journal, write down what you took. And speaking of which, since I'm doing that, I talk. So write down what you took, if it's flower, concentrate, vape, edible. Look at this is their old menu. Flower, right? And you write down what it was, okay? Oh, it was a sativa. It was at 30% and I smoked it, or I put this in my morning coffee, which, speaking of my morning coffee, and so anyway, you also then, I often write down my symptoms, like what am I feeling right now? Like it's my spine or my hip or my knee is really bugging me, or just feel like crap and it's depressing and I don't want to get out of bed. So these are all like things that I would just jot down really quick. And then you know what? Later on in the day when I remembered, I would write down my results. I'd write down how I felt. And then I would be able to follow that information and make good choices on what strains work for me, okay? Because like sour joker. So, a lot of us like our sour diesel, right? So we've got our sour end of it. And then joker, of course, is another level of the breed. Kosher Kush, big fan for me. I love my Kosher Kush. Jack Herer and Durban Poison. I guess I just found out like they took away the poison out of the name because once they went rec, they weren't allowed to keep poison next to it. So I thought that was kind of humorous. I found that out like a week and a half ago. So it's just called Durban. So anyway, but this is the one with THCV in it. So these are kind of and then like I said, East Coast Sour Diesel. Those are my favorite like sativa strains. And then my indica for nighttime, my Kosher Kush. But yeah, and then how did I find that out? Well, this is what people use for helping with curing their cancer, or even, to go along with cancer, to help with chemo and help with all the pain and discomfort and all that. So these are all different. I wanted to just show it real quick because I ended up on here. So these are all a bunch of different ones they used to have there. And they still have different ones, and then it moves into the extracts. But the reason why I did all my own advocating and writing it all down is because now I can tell you which ones work for me. And I would write down if I got munchies, which LA cheese. Oh my God, did I get munchies off of that? So, and certain strains have different terpenes, which are good for you, like lemon Durban. Lemon Durban has the limonene in it. So again, a great terpene to have for a lot of, again, my symptoms. So you are your own doctor. Okay, so I hope this helped. I hope it's all kind of coming together. Please feel free to, please, again, if you haven't subscribed, subscribe, share, like the videos. Let me know what else you want to hear about or something you might want to hear in more detail. I will absolutely do the research for you and get a video out there. So I hope everyone is doing well. Happy dosing. Enjoy the summer.